This video was supported by an educational grant from HealthMark.
Hi, I'm Christina Hopkins. My work is in environmental health and infectious disease, and I'm a research manager at Ofstead Associates, which is a company that specializes in conducting real-world research in order to support improvements in patient safety and occupational health. Now, I'm here today to talk about one of our favorite topics, visual inspection, but not of endoscopes, rather of lumened surgical instruments like suction tips and shavers. Now, if you've been with us for a while, you know that when we stick boroscopes into endoscopes, we see some pretty ooky stuff. We've got damage, and dirt, and droplets. We've got shredding of the channel lining, and alarmingly, furry stuff. We think this was a chunk of tissue buried underneath the elevator down in the distal end of a duodenoscope, but in any case, gross. So we started thinking, what about other complex lumened instruments? And we're not the first. Boroscopes were actually used in arthroscopic and bone shavers before they were used in endoscopes. And this happened during an outbreak investigation more than 10 years ago, when 7 knee and shoulder surgery patients acquired infections with the same pathogen. Now, investigators suspected that dirty instruments might be involved, and so they used a boroscope to look inside the arthroscopic shaver handpiece lumens. There, they found visible soil like the picture on the left, and chunks of tissue and brush bristles inside the suction channels, like this example here from studies done by our friend Johannes Zizi and his colleagues at the University of Michigan. Now, since the work done in the early 2010s, there hasn't been any published research that we know of boroscope exams in surgical instrument lumens, so we decided to check them out ourselves. We partnered with sterile processing managers at 2 hospitals to inspect suctions and shavers with the goals of characterizing the internal design features of various instruments to see what they look like inside and assessing the nature and frequency of visible defects. We also wanted to evaluate the impact of recleaning on any visible debris or residue that we observed. Now, to give you a sense of how this worked, this is what inspecting a yankauer suction tip looked like. The boroscope was fed in through the proximal tip where the suction connects, through the grip, and then out the removable suction head on the distal end. And along the way, we got pictures of inside surfaces like this one, and they didn't always look how we expected them to. Now, we also looked at a different type of suction called a Fraser suction. This has a very narrow lumen used to help suction out small areas during surgery. Just like the yankauer, the proximal end has a flange or a Christmas tree that connects to your suction. And when we looked inside, we saw a ridge where the lumen narrows, and we think that that's where the flange connects to the rest of the tip. It also seems like it could be a tricky spot to clean. Now, further along, we hit the grip, which is labeled with the size of the suction tip, in this case a 12 French, and has a suction valve, which is just a hole in the middle that the surgeon can cover or uncover to control the level of suction during the procedure. Now, you can see this hole from the inside too, and it could look something like this with nice, crisp, smooth edges. Or it can look like these. Now, on the left is the suction hole of an 8 French suction tip, and the image isn't quite as clear here because the 8 French only fits a very small boroscope. But even so, you can still clearly see the rough edges here and over here on this 12 French suction. And now the important thing to note is that we couldn't tell by looking at the outside which ones might have these rough surfaces on the inside. Now, at the other end, we have the distal tip, which commonly looked like this when we were using a boroscope. Okay, so that little tour was fun, but do you think we only saw beautiful, pristine instruments? Of course not. Can you see the little fibers in this picture? We actually wondered if it could be lint from towels, because we've seen that in endoscopes during previous studies. So we kept the boroscope running from the lumen while a supposedly lint-free towel was rubbed over the distal tip. Now, it looked to us like new fibers were deposited in the channel, and we wondered if the little fibers could be removed. With a quick blast of forced air, the fibers were blown out, which is great, but we don't love the idea of blowing out whatever is in the lumen all over the clean side in a sterile processing department. And we really need to think critically about whether low linting or lint-free towels really are. Now, we talk more about our lint findings in our previous Boroscope YouTube video and in a manuscript, both of which are linked in the video description. We also observed a lot of chunks of stuff inside the suction tips. On the left, you can see what looks like a blob of orange jelly right before that suction hole. And on the right, you can see what looks like a trail of whitish debris in the lower left. Now, both of these were in the same suction tip, so the team sent it back for recleaning and reinspection. And when we used a boroscope to do a quick recheck, the debris was gone. But it's not all sunshine. Here's a shot of the tip after recleaning. Now, I don't see the yellow goo anymore, but I do see something else. Can you see that? It appears that the recleaning process left behind an interloper, a brush bristle. Does that sound familiar? Okay, we have one more section to talk about, pool sections, which are very different from the others. These are used to section large amounts of material without accidentally capturing tissue. So pools actually have an inner suction tube and an outer sheath, and the inner suction tube has a proximal suction port to connect to the suction, and both have distal tips with holes to facilitate the suction on the end. Now when we take a close look at that outer sheath, you can see that it's perforated all the way up the side by lots of tiny little holes, and these help spread out the force of the suction. You can see that the distal tip also has a hole, and from the inside, the holes in this particular suction tip appear to be pretty smooth. But lest you think that means they all look like that, here's the inside of another one that has what we could only call claws of jagged, uneven metal around the hole. I personally wouldn't want to run my Boroscope into that. And here's another example. In this pool, the holes on the sides of the inner tube are also exceptionally jagged. Can you think of any implications for features like these? Well, if you zoom in, there's what appears to be a little bit of tissue right there that's caught on those rough edges. Now, we don't think it's a stretch to think that claws like these could catch lots of patient materials, and I wouldn't be surprised if they can shred a brush too and potentially leave brush bristle fragments behind. Okay, so let's switch gears. We also looked at a bunch of arthroscopic shaver handpieces, like the ones used in the outbreak we talked about at the top. Now in these, there is a lumen that runs the length of the shaver from the distal end to the proximal suction port. Suction is controlled by the suction control lever on the control handle. And let me give you a view of this from the top. Now can you see the suction control lever and those buttons too that control the shaver? Keep that in mind. Now, the first thing we noticed when we inserted the Boroscope into the proximal suction port was that the surface was fairly rough just inside that proximal end. Now, it kind of looked to me like the texture you'd find on a weightlifting bar at the gym, kind of rough. And like the sections, there's also a ridge or a lip a couple of centimeters inside that suction port opening. So when we passed the Boroscope from the proximal end of the lumen to the area underneath the suction lever, we found that there's actually an elbow where the lumen bends through this valve that you can open and shut by moving that lever. This is actually how the surgeon controls the suction. Now here the lever is in the open position, so the valve is open. But when you flip the lever in the opposite direction, it actually closes that valve. And can you see how that closes just like a hood over the channel? Okay, so once we oriented ourselves to the features inside the shavers, we started to see little things like a little chunk of debris near the ridge right here. A white chunk of debris over here. Now, yuck. Remember that this instrument is used to shave bone and remove tissue during orthopedic surgery, so we can only imagine what that chunk is. We also saw a bunch of loose fibers right here inside a lot of the shaver lumens. And lots of rusty colored staining and mottling. We took a video actually approaching the little ridge inside the suction port, and if you watch in the upper left side, you can see that there's patches of brown discoloration on the surface, and once we got closer to that ridge, we saw some really gnarly brown gunk stuck there. Now as we rotated the Boroscope, we could see that the whole ridge was coated. And after 4 rounds of re-cleaning, a little bit of that gunk had been removed, but it was still clearly there and probably baked on due to all of the sterilization cycles that this shaver had undergone. And in another shaver, we advanced the Boroscope all the way to the suction lever elbow, and there we saw this showstopper. Ick, ick, ick. Now we didn't know exactly what it was, but we suspected a mix of bone fragments and fatty tissue. In any case, nothing you want in your shavers. This one also underwent the 4 rounds of re-cleaning and re-inspection, and after the 4th round, the debris appeared to mostly be gone. However, it looked to us like the surface underneath had degraded a little bit, maybe etched or pitted from long-term exposure to bodily fluids and tissue. Now, in any case, the stakeholders were alerted about the situation, and both of these shavers were removed from service because there was no confidence that the devices were clean or intact enough to ensure patient safety. And that brings us to our 3 biggest takeaways. Number 1, we think that there's compelling reasons to look inside your lumens. Number 2, we are sure that you will find something surprising when you do, especially if you haven't been doing it routinely. And number 3, before you even think about poking a Boroscope into an instrument, have a plan. If you've never looked in your instruments before, chances are you're going to see something, or a lot of things, that you're going to have to address. That was the case in our study with the shavers, and we were glad that we had brought stakeholders along from the beginning, instead of surprising them with a big, fat, urgent, or expensive problem when they didn't even know we were looking. Now, before you start, think about who at your site should know and be involved. Supervisors, other departments. You'll want support if you find anything. Where will you conduct inspections? On the clean side? In decontam? What will you do if you find something you need to address? Who should you report it to? And finally, if you do decide to implement Boroscope exams as a policy, how will you support your frontline techs in learning new skills and having the time to handle the increased workload? If you'd like to know more about this, check out our 1-hour CE webinar on the visual inspection of surgical instrument lumens and our YouTube videos. You might notice we actually have a playlist with several videos on visual inspection if you're interested. For more reading, see published papers by Tosh, Azizi, and us. All of these resources are linked in the video description. For more information, visit our website or contact us by email at education@ofsteadinsights.com. This webinar is supported by an educational grant from Healthmark. Healthmark also provided boroscopes used to take some of the photos in this video and the webinar. Please contact Healthmark directly for further information about tools for performing visual inspection at www.hmark.com. We had the privilege of working on this project with experts who are certified in sterile processing and have advanced training as certified instrument specialists. Thanks to Steve Adams and Andrew Gens. And finally, here's a list of disclaimers to review before making any changes to your policies or practices.